Hey, how are you doing today?
Doing good.
My name is Zach Splinter. I'm a student physical therapist at the University of St. Augustine. And your name is?
Jacob here,
And your birthday?
May 23rd, 1995.
Okay, and let me double check that on your wristband. Great. So from what I understand, you're having some back pain today, and it's as a result of degenerative disc disease of the lumbar spine.
Yeah.
So you're having low back pain.
Mm-hmm.
Okay. So basically, because you're having pain with your lower back, and it's because of your degenerative disc disease, I want to do what's called traction. So traction, it basically works by kind of pulling your vertebrae apart slightly, and this works by decreasing pain, by centralizing the pain of the discs, and by reducing muscle spasms by elongating the muscles in the area. So does this sound like something you'd be interested in doing today?
Mm-hmm.
So on a scale of 1 to 10, 10 being the worst, what would you say your pain level is today?
Roughly 7.
7? Okay. So you've got quite a bit of pain. So I think I want to start with the traction treatment first. So before we get started, I need to check to make sure you don't have any contraindications or precautions. You don't have COPD, you're not pregnant, you're not claustrophobic.
Nope.
You haven't had any recent spinal surgeries like a discectomy. You don't have OA or osteopenia. What about history of steroid use?
Nope.
Okay. So now that we cleared you on the contraindications and precautions, we can go ahead and get you set up. So, all right. So next, if you could please stand up for me, I'm just going to inspect your skin and make sure that you don't have any rashes, any abrasions, anything like that. And then I'm going to do a little bit of sensation testing in that area. Is that okay?
Yeah.
All right. So if you could go ahead, yep, turn that way for me. All right, so the skin looks intact. You don't have any rashes or anything that looks out of the ordinary, which is good. And then I'm gonna go ahead and do sensation testing. So I'm gonna go ahead and take this and I'm gonna touch your cheek with it. So that's what it's gonna feel like. And then I'm going to do your lumbar area. And so anytime you feel the cotton swab, I want you to say yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes.
All right, great. Go ahead and lay down up here for me. So get you set up so that this is gonna be right there, right around your lumbar spine. Right here. Okay. So I'm gonna get this. I want this nice and tight, but not too uncomfortable. So how does that feel right there?
It's fine.
Feel tight?
Tight.
Okay. And go ahead and wrap this around here. Tighten this one more time. Okay, I feel tight there?
Mm-hmm.
Okay, so next I'm gonna hook you up to the machine. I'm gonna get this hooked up to the machine. Okay. So we got you taut there. Next we wanna make sure that your knees and hips are flexed so that they're both at 90 degrees. So I'm gonna move this a little bit closer towards you. Okay. Does that feel okay there?
Mm-hmm.
Okay, make sure that's stable. And then I'm gonna go ahead and unlock the table. So for the settings, what we're gonna do is I'm gonna set it on intermittent. So it's gonna be a 1-to-1 ratio of 10 seconds on, 10 seconds off. And then we're gonna start off with 5 minutes. So we're gonna do 5 minutes. I'm gonna check in on you, make sure everything's going okay. And then if everything's okay, we're gonna do it for another 10 minutes. I have this button right here, so if at any time during the treatment you start feeling pain or uncomfortable, you can just hit that and it will automatically stop and I will come over. I'm also going to give you a call bell because I'm going to step out, or I'm going to be on the other side of the room, so you can hit that button to stop it and then ring the call bell, let me know what's going on. So we're going to go ahead and I'm going to go ahead and start the treatment. And I'll wait 5 minutes and then come back. Okay, it's been 5 minutes. So how are you feeling?
Feeling good?
Say, you're not having any pain, anything out of the ordinary?
Nope.
Okay, so we'll go ahead and do this for another 10 minutes. Okay, and so that was a total of 15 minutes. And forgot to mention to you that the pulling weight was about 1/3 of your body weight, which was about 80 pounds, because you weigh about
80 pounds.
or you 60 pounds, you weigh 180 pounds. So, all right. Now that we're done with the treatment, I can take that for you. Okay. I'm gonna go ahead and get this. I'm gonna go ahead and get you unhooked. But we're gonna have you lay here for another 5 minutes just to make sure that you're not dizzy or woozy. You don't have anything else going on. So. Okay, so you comfortable in that position?
Mm-hmm.
Okay. All right, another 5 minutes has passed. So how are you feeling?
Feeling good?
Okay, so what would you say your pain level is?
About a 3.
Okay, so it seems like the traction treatment has helped decrease your pain some. And I'm gonna go ahead and move this for you. If you could please sit up for me. We're gonna get started on some strengthening and endurance exercises for the lumbar spine. But beforehand, I'm just gonna check the skin. Everything is intact, and there's no problems.